Dr. Khalifeh. Today we're going to inject lip fillers. We've done a little bit of injections that we didn't show in this video. Right now we're going to concentrate on the lips. She has a small bump from a very well done surgery, but she had a little cancer removed here. There's a little bump that we're going to mask. We're going to also try to invert the upper lip. And we're going to finish up by putting a few drops into the lower lip. When I inject lips, I usually use one of the lip specific fillers, Restylane Kiss or Versa Lips. We're using Versa Lips today, but they're both, in my opinion, very interchangeable, very good fillers. When I inject the lips, I inject with a needle. That's a little bit different than I use a cannula wherever I can, but the lips is an area where you want to be intramuscular and submucosal. And you don't want to get too superficial, and therefore we're going to use the needle. The little stick. Now I like to use a fanning technique. Fanning means we go one puncture site. And with that single puncture site, do one vertical line, one angled line, and one horizontal line. Then we're going to work our way medially doing that. Okay, one vertical line. Again, you can inject fillers in many directions. You can change the name every time you vary the direction into a different technique, but important thing is to have a good eye and to inject slowly. Okay. Now, before I move on to the other side, I like to follow the contour. So I put my needle up like that, and I start filling this area from this side. And the lip fillers tend to be thick, so you have to push hard to go slowly. Now we're going to reverse directions. Video. Whenever I want to evert the upper lip, basically we're going to try to fill some of the wet mucosa so that it sits a little heavier on the teeth and kind of pops. Right now the wet mucosa kind of hides inside the mouth, and we're encouraging it to come out with that filler. And close your lips. And you can already see the difference. We're getting there. We're working medially. You can see laterally how it's starting to evert. Now it's important not to over-inject. She has a nice shape of the lip, and you don't want to efface it. You want to just go and erase the cupid's bow area and filter them. You don't want to just, if you overfill it, it looks ridiculous. I'm going to come from this direction. I like to, again, inject, keep that curve. And I'm going to come laterally here and start my fanning technique from the corner. And this goes slowly, but before you know it, you find the product tube getting smaller and smaller. So you know you've transferred the product into the lip. Usually one tube for both upper and lower is what I usually do. With fillers you can always add. You don't want to overfill. And usually one tube looks natural and is sufficient. One last time in the upper lip. I'm going to do a little bit in the filter, okay?
Okay.
Here, okay. So you know it hurts. I switched needles, can make it a little less painful with a fresh needle, but I like bringing out that filter column. And always a nice touch. And put a little tiny drop of product. You can see how bringing out the filter column is always aesthetically pleasing. Do this side now, and 1, 2, 3. This is a superficial injection, very much into the dermis. That's it. After the product is injected, we gently massage it into the lip, spread it about. Injecting it smoothly is important, but any small lumps will be massaged away into neighboring areas to spread the product evenly. Okay, now we'll take before and afters and show. Close your lips. Okay, so now we've done the upper lip. We're going to put a few drops into the lower lip. Now we're going to start. The lower lip tends to be a little simpler. It's more uniform, so there's less changing of angles. It's nice to get a little puffiness in the area that corresponds to the Cupid's bow. Okay, all right, that's good for that. Let's inject a little bit more on each side. Massage it in. Our total injection into the lip is going to end up being about 1.3 cc's. Close. And close. I like it. We'll leave the rest for when I see you next week. Can always add fillers, but I think we've gotten a natural look. Let the swelling subside and touch it up if needed.